So can you hear me?
I can hear you, but okay. I was muted. Okay.
Yourself. Okay.
Now it is okay, I think. No?
Okay.
Okay. So good morning, good afternoon, and good evening. I am Dr. Shaji Varghese Kudiyat, welcoming you all to the 310th continuous uninterrupted Zoom session of International Forum for Promoting Homeopathy. Before we proceed, I would like to have 1 minute silent prayer for the success of the visions and missions of IFPH and also for the successful conveyance of the message expected of today's Zoom session. Let us have 1 minute silent prayer. We are on an uninterrupted 310th Zoom session. For the information of those who participating in our Zoom session for the first time, IFPH is an organization formed by a group of homeopathy lovers, doctors, and students at the time of pandemic, when the world was affected with a very difficult problem as per the opinion of WHO. And incidentally, homeopathy is emerged as the best solution in prevention, treatment, and rehabilitation for this pandemic. But the world at large remains unaware about this possibility. So we, a group of passionate homeopathy doctors, lovers, and students, came forward to spread this message across the world. And since then, we started the Zoom session, and we are uninterruptedly, continuously conducting these Zoom sessions. Initially, we conducted in our local language, in Malayalam, up to 100 days. Then we started to conduct it in English, the international language. And now we are conducting it in 2 languages, in our local language, in Malayalam, and also in English. And this is the way we are continuing our journey. And today we have a very important guest from Germany, who is none other than Dr.Beatris Gesner, who is a medical doctor since 35 years, specialized in dermatology, pediatrics, and general medicine. She is practicing homeopathy since 30 years. Worked in the only hospital in Germany specialized on homeopathic treatment of severe conditions with allergies, asthma, and neurodermatitis since 1991 up to 1993. And she is working privately in her private clinic since 27 years. She is teaching regularly in the courses of the Central Homeopathic Organization of Germany, and also giving seminars in Portugal since 8 years. So let us welcome Dr. Beatris, who will be speaking to us on homeopathy and skin disorders, as she is a dermatologist. Over to you, Dr. Beatris. The floor is yours.
Okay, thank you very much. And greetings from Germany to everybody. Good morning, good afternoon. And thank you for inviting me, Dr. Shadi. Today we have a special topic that's dermatologic disorders. And why I'm talking about this to you is I had a lot of experience during my life with dermatology. When I was a young doctor, my first clinical years I spent in the University Hospital in Berlin on the dermatology board. And for me, it's perhaps I talk a bit about this also to you. I will talk about that experience a bit. I will talk about specialties we have to think of if we treat skin diseases. And I have some cases for you explaining the way and also the potencies and also the way of working with LM potency, which is very helpful for me. And so in the beginning, I started my first days in dermatology in the hospital. And to be honest, this is not so easy because we are not so used to see severe skin conditions. So what kind of patients we had there? We had a lot of psoriasis patients all over the body, inflamed. We had a lot of people with chronic urticaria who had to come, and they had a special kind of diet, just having one food, next day another food, next day the third, another food. So we had a lot of young people with severe acne. You could see all the pus coming out of different parts of the body. So the first 2 weeks were very difficult for me, but later I got used to that. And I think that this is helping me also today. If a patient is coming with a severe skin decision, I don't get afraid. So that's coming from that time. And what was also interesting as a medical doctor, often patients came with strong skin eruptions and we didn't know what had happened before. So we also had to reduce chemical drugs, chemical medication. If a patient is 60 years coming with a strong rash, a strong eruption, and had 5, 6 chemical drugs, we had to stop to see what would be the cause of that disease. And for me, that was also a great experience to see that people could live with much less chemical drugs than they thought before. So I have great advantage nowadays also from that experience. And I continued later. I went to pediatrics and also general medicine. And I'm speaking with India, Katarina. And later I was working in a homeopathic hospital in the south of Germany, also with very severe cases. And after that, I started my clinic, which I'm having now more than 27 years. And the patients in my clinic are perhaps 30–40% dermatological patients, a lot of children with atopic eczema, neurodermatitis. And the other patients are normal patients with other disorders. So today we will start with dermatological problems and the cases. Could we please share the screen, Dr. Shadi?
Yeah, please proceed.
Yes, yes. Okay. You can see that?
Yes.
Okay, fine. So the skin has a lot of specialities. On one hand, the skin is a border between us and our surrounding. And the skin is like a big organ. It has different functions. One function is an excretory function. So we can liberate ourselves through the skin. If there are some problems with the metabolism, with the intestines, the body is able to produce skin eruption to liberate himself from these kind of toxins. Also, if we have other problems of the skin and skin likes to liberate from this, it's possible. So that's the physical point of the skin. At the same time, it is a whole immune system. We have all kinds of T lymphocytes, immune acting bodies in the deeper layers of our skin. And the skin is deciding, is something adverse to us? Is it wrong for us or not? Every moment our skin is deciding this. So if there's some disorders in that point, you can have contact dermatitis, we can react to pollen, just like an example. And what's also very interesting, many psychological elements go together with the skin. So if we touch a person, we feel the skin, we also feel the energy of that person. And what is interesting, that in the evolutionary development of man, we have these 3 levels. We have ectoderm, mesoderm, and endoderm, when the embryo is developing. And the brain and the skin come from the same layer, which is the ectoderm. So what we also see in practice is that there are a lot of psychological feelings, emotions, which can be expressed by the skin. Okay. We all know the word atopy, and this comes from Greek, and it's meant to be unusual. In our Chirembe is our medical dictionary. It's saying it's a summary term for the genetic manifestation of the hypersensitivity reaction based on a genetic predisposition. So we have atopic eczema, we have atopic conjunctivitis, rhinitis, asthma, enteritis. And which is interesting, in conventional medicine, the doctors know also, the pediatricians know also, if they treat a child with atopic eczema, with cortisone, after a while, the eczema can be better, but an asthma is occurring. Them, it's no problem. Okay, your skin is better, now we treat your asthma. We as homeopathic doctors, of course, see that in a different way. So what is interesting, if you see here, it is a hypersensitivity reaction based on a genetic predisposition. What does that mean for our homeopathic treatment? We have that predisposition, but this can be treated. And what we have to treat in the patient is that hypersensitivity. And luckily, with homeopathy, we are able to do this. And luckily, with homeopathy, it's such a great thing also in practice with the clinical cases. We don't have to know the cause of the reaction at that moment. If we see the symptoms, if we see the general situation or condition of the patient and see the remedy we can give, that's enough for us. We don't have to find out, like the dermatologists, what is the cause of the disease. And talking about the conventional dermatology, for me, it was an interesting term to stay there and see all the different forms of skin eruption which are possible. There's also a lot of autoimmune diseases which produce skin eruptions. And but in dermatology, they know a lot of words, all classifications of different skin diseases and subtitles and subtitles, but the therapy is very small. And that's why I left conventional medicine. It's so small. You have cortisone, you have light therapy, you have stronger medication, autoimmune medication with a lot of side effects. You don't have so much more possibilities. So, but for us as homeopathic doctors, it's very important to know if we treat an atopic eczema and there will, with homeopathy, and they will start an asthma, we know it was not the right way. So for us in homeopathy, the most important is no suppression. And when the parents are coming with their little children, with strong eczema, and what shall we do? We don't want to use cortisone, but perhaps we cannot live without it. I always say, okay, what is the idea of the treatment now? The child should be better and better by the time. But the most important for you as parents is that the child does not get cortisone or too much cortisone, because this will be a suppressive treatment. Okay, just to explain a bit, if we talk about allergies, we have two types of allergies. We have the early type, which is IgE mediated. So if you eat something which causes an acute allergy, it will be very soon. So if a child is eating an egg and is allergic, it will be within 2-3 minutes and mostly around the mouth. So you know, okay, this child has an allergy. Or other kind of foods, is drinking milk or having some special fruits. And that will be very sudden and you can see it directly. also with drugs or with pollen. Honestly, when I started my clinic, I had a lot of skin patients. And when here in the south of Germany, I live in a beautiful place, a lot of nature, but that also means a lot of pollen. And so I was teaching my patients, and the springtime came, that's in Germany, March or April, and a lot of aggravations. And I said, oh God, what's happening here? What's happening with my patients? What's happening with the remedies? Until I understood it was a reaction on the pollen. So these are the acute types of allergies. We have the late types of allergy. So if you have contact to something which is you are allergic, it can take 2 or 3 days after you will get skin eruptions. But normally these are on the deeper layer on the skin, and where you have the lymphocytes or other immune active antibodies, and there you will have more vasodilatation, and it will be more nodes, pustules, plaques with how you say, this form of swelling. Prurigo, I don't know whether you know this, it's also a kind of little boils which are itching tremendously. Okay. We also have pseudo-allergies. They produce the same clinical symptoms, but you don't find IgE. And we have a lot of intolerance reaction. That means you can eat a bit of, drink a bit of milk, but you drink more and more, you will have reaction. Or you can eat a bit of sugar, but if you're eating more and more, it will react. That is called a dose-dependent intolerance. Okay. So very important to know in the treatment of children, the first 3 years of life, if you make allergy tests, normally they are unspecific. You cannot count so much on this. And here in Germany, we are trying to do a test with a bioresonance. I don't know whether you know this. It's by kind of energy radiation, and try to test the food with the children. So very important in the treatment, we should not fix on the allergy as a cause of disease. And also the skin reflects the situation of the emotions and of the soul. It's a very special organ. So a very well-known German homeopath, I know him in the south of Germany, he was treating a lot of skin conditions, and he said, skin diseases rarely have external causes. The morpheme of the skin is a visible reflection of the internal pathological change. So that's always, we have to keep that in mind. And Kent said, the great danger is always to choose a remedy that only fits the external symptoms alone. That means on skin symptoms. And at the same time, to ignore those symptoms which the patient otherwise has. That is to ignore the condition of the whole organism. And so that's very difficult to understand now, but it is like this. Atopic dermatitis is not a skin disease. So we are treating the patient and not the skin. That's very, very important. We know as homeopathic doctors, but still, if a patient is coming strongly affected, you get that emotion, oh, that has to become better. And we try to treat the skin, but still it's very important to understand also in difficult situations, we are always treating the patient. And I can say clearly in the 30 years of my experience now, concerning the remedies, I use the normal polycrest remedies with very good result. And I use nosodes, the normal nosodes. And sometimes I use some special remedies, but these little skin remedies, normally they are not so common in my office. What is, let's say, what can be very useful are the salts of the big remedies, like arsenicum, arsenicum iodatum, arsenicum moniaticum, or natrium. Natrium silicatum is a great remedy in my clinic. So if you have symptoms of natrium and of silicea, treating the patient, try natrium silicatum. Since I know this about more or less 3 years, I have more perspective in that remedy. I have a lot of patients with good results on that remedy. Or magnesium modiaticum, also a great remedy. Or if you have calcium and sulfur symptoms, and sometimes this happens, we always think, calcada carbonica is so different from sulfur. That's true, but there are children or patients which seem to have both parts inside. The temperature is not that hot. The structure, they are a bit more structured, but not really. So you can have the mixture. Calcarea sulfurica in my clinic is a very common remedy, especially in the children. Okay. So what's the cause of allergic eczema, of allergic diseases? It's multifactorial. We have different causes. And one clear cause is the environment. So if there's a lot of pollution and we are getting toxins into the body, sensitive people can react. Nutrition is a big topic. So I advise my patients, and normally they do themselves, to give the children biological food. We have here in Germany the opportunity to have very good biological food without any toxins or reduced toxins. Okay, and very important is the cause of the way of the family. If genetically, if the two parents have skin problems or allergic problems, the child it's more difficult to treat the child. The situation is more difficult, but possible. And psychological points are very, very important in the children, in the families, to see where is the stress, and to put it in the picture of our remedy. So the holistic view to treat is physical, psychological, and also social, because skin diseases have a social effect on the patient and also on his family. If somebody in the family always looking different from the others with all these eruptions, that's not so easy, also not for the parents and the grandparents. Normally the grandparents are those who are saying, no, you need a good treatment, take cortisone, the child should be better. So we have it's also very important to stay with our patients and explain and give confidence. Yes. Okay, start with the clinical cases. That is a little girl, 1.5 years old, coming with this pustulous eczema. So the photo is not 100% clear because it was very difficult to take a photo because she was moving all the time. She did not like that I was taking that photo. So she's coming from my colleague, pediatrician, and she said, I was treating the child and at the end I gave sulfur and now it's getting much worse. So what happened? This child is coming from a family from Poland. That's the next country to Germany. And they went on holidays for 4 weeks. Before, everything was fine. No problems with the skin, nothing. And there, the little girl was drinking a lot of milk because it was in the countryside. And she had a lot of mosquito stitches. So afterwards, the skin started to itch, some little pustules, and it was getting worse. My colleague was treating, and at the end, with sulfur, it was horrible. Now she's coming to me, and the parents are saying, the situation is very difficult. The child does not sleeps very badly at night, and it's itching. She's in a bad mood. And when I wanted to examine her, it was very difficult. She was moving the head, crying, no, no, I don't want it. So she was in a special state. And to get some symptoms, it was not so easy. But there was one clear symptom, which was that at night, at 3 o'clock at night, that was a special time where the itching was worse. She was waking. So if we have such a nice modality, we should use that. It is a small child. So, yeah, we have that. It's a very lean child. She does not like to be touched, not to be looked at, says no, but she has no fever. And at the moment she had a coryza with albuminous discharge. So I was also taking that acute symptom. And if we repertorize, what was clear? Didn't like to be looked at, didn't like to be touched. 3 a.m. aggravation. Milk aggravation, we don't know 100%. We have the suspicion, but we don't know. She's lean. The eruptions are pustules. It's not an eczema. These are pustules. And the discharge of the nasal was albuminous. So as a first remedy, we see natrium, muriaticum. We also see arsenicum, calcarea, silicia, lux vomica, lycopodium. All these remedies are possible. We don't take the first one in the repertorization, but natrium muriaticum didn't seem so bad, because I also was thinking this family does not come from Germany, and they also feel a bit homesick. They go to their own country, having holidays with the family, coming back. So I thought perhaps natrium could be a good solution. So I was giving LM potency. In my clinic, I only work with LM potencies in the beginning of the eczemas or other skin eruptions, because you can see in a few days whether the remedy is right or not. So I gave twice 5 drops, twice daily. And I said, please, with the pustules, with the legs, please put some vinegar in water and give some applications to take out the heat and the inflammation. And please, no milk at the moment. So follow up. 4 days later at the telephone. In the beginning, Eva was a bit more restless at night. She also has eruptions at the face and at the arms, but not so much as at the legs. The face was a bit better, but the legs are the same. Okay, I said, we continue. 1 week later, sleep is a bit better, legs a bit better, but still a lot of pustules. So that's not so much how we like it. We see it's a bit better, but we don't see a clear amelioration. So the parents come again, we are talking, and the father said she developed a panaritium around the nail. And this is an old symptoms. In the age of 20 months, she already had that. She has a tendency. And he said also the skin is not such a good healing quality. The feet are cold and wet, itching at 3 o'clock still, and she still doesn't like to be examined. So if we go to the repertory, and here's a picture. It looks a bit better, it is a bit better, but it's not like we would like it to have. So if you go to the repertory, still aversion to be looked at, aversion to be touched, 3 a.m., lean constitution, eruptions, pustules, unhealthy skin, and nails, fingernails, panaritium. If we put this in, silicea comes in front of natrium. So I gave silicea twice a day, 5 drops. 4 days later, at night, she's much calmer. Less redness, less pimples. So what's happening if we are treating in the right way? often, also with skin diseases, the first sign of amelioration is that the patient is feeling better, more calm, more ease. It can be that the eruptions still are very strong, but if the parents say at night she's much calmer, then we know we are on a good way. So I continued twice a day, 5 drops. So 1 week later, more relaxed, feels much better, sleep much better, the pustules are gone. For the first time, Eva looks at me, I can examine her. So also the mental state is changing. Look at the picture, much better. You don't see any more pustules. Okay. 10 days later, it was better, but now it's getting worse again. So that's also a crucial point now. And the therapy was still twice a day, the 5 drops. So if it's getting better, we have to reduce. And what shall we do? It was better, worse again. I reduced the doses, just once a day, 5 drops. And 2 weeks later, 4 weeks after the beginning of the Lycea, here we have that picture. Quasi everything is clear, just that little spot she has. So I said, please reduce every second day to have that 5 drops. And here she is. And now she's looking at me and smiling. Happy parents, happy child. Okay. So discussion. What's interesting in this case? First point is to choose a right drug. And Silicea was quite up. And in comparison to Natrium muriaticum, now after we see it was helping, we could say that Silicea as a remedy has much more activity in pustules than Natrium muriaticum. And very important to the dosage with LM potencies and the local treatment. For me, treating skin disorders, the modalities are very, very important. Also with that child, if that child would not have cold and wet hands, if the hands and feet would have been very dry, for me, difficult to prescribe Silicea. Possible, but more difficult. So, as you know, the modalities are very important. Cold heat, sweat. If we have the aggravations time of the day or night, that is very helpful. If there are clear reaction on food, we can take this as a symptom. Okay. And the psychological findings are very good in the differentiation of the drugs. But we don't prescribe on psychology in such cases. It's very important that the psychological findings are fitting, are consistent with the general symptoms of the patient and its modalities. And if the 3 parts are fitting well together, we have a good chance that we found a good remedy. But not only prescribe on psychological alterations. With that girl, we could have taken the rubric also obstinate. She did not like this. And there's also Silicea. Okay, also very important to assess when is a patient better. First point, he feels better. That's the main thing. The itching is decreasing. Okay. When the wet skin gets more dry, also better. If the skin was very red and the patient is coming with a lot of scabs, this is no problem. It's a sign of amelioration. Like if you have a sunburn, you are totally red, and after a while, after 1 or 2 days, it will get more bright, and you will have that scabs. That's a normal reaction after an inflammation of the skin. Okay, patient feels more relaxed, sleep gets better. Yes. The treatment of chronic skin diseases takes time, and we have to explain that to the patients and to the parents. But to find out whether the remedy you want to give is working or not, in my practice, I only need 1 week. I don't give high potencies and have to wait 4 weeks. I'm not doing that. For me, the LM potencies are very helpful. We should be able to judge quickly whether the homeopathic remedy is working. And we should await aggravation, really. I don't know how it's possible for my colleagues to work with C200 in skin diseases. I don't understand. So I really love the LM potencies because they have good control, you can control very good. And they have fast, effective assessment of the remedy and little aggravation or little first reactions. And also very important, you can give LM potencies, as you know, if the patient has to take allopathic drugs, strong drugs. We still can treat with homeopathy in the 2 lines. I would not advise to give a patient with asthma, he's on medication, perhaps with cortisone or with sprays, just to stop everything and give homeopathy. No, it has to be step by step. I do this like giving LM potency at the same time, and if the patient is better, we can reduce chemical drugs or sprays. Okay. How do I do that in my practice? In light cases, I give 5 drops daily. In medium, twice 5 drops. And in severe cases, twice 10 drops daily. Sometimes with sensitive patients, I have to make 1 more dilution in the second glass. Also, that can be possible. The complaints can vary, but stay strong for 1 week. Give the medication for 1 week, and you will see whether it's helping or not. It's very, very crucial when you are treating skin disorders, especially neurodermatitis, which in itself has that waves of getting better and worse because there are allergies and everything. It's very important not to change too much remedies. If you do this, you are lost. Stick to your remedy, take your time, and take the modalities. Okay. I will go forward to the second case. So that's a case of a drug-induced lupus erythematodes. That kind of reaction is not so easy to treat. This was a nurse working with my colleague, my pediatrician colleague, and she came with that skin eruption. She's 44 years old, and since 1.5 years she had some redness on the nose. And in August 93, she had a genital abscess, which was treated by antibiotics and cortisone. That made no problem for the skin. But October 94, she got a pyelonephritis and was treated with bactrim and furadantoin. Furadantoin is a special strong remedy for the kidneys. And in the 4th week of taking that furadantoin, the face started to react. Complaints. She has a burning pain and itching in the face. Better with ice cubes. The temperature is warm, with a tendency to have cold hands and cold feet. And she likes all kinds of sports, which is nice. She's a very active person. But it is strong. So what are the symptoms, the clear symptoms? We have the redness of the tip of nose, which was a beginning. So I did take this. We have the burning pain, and we have the pustules in the face. In the history, we had that abscess, genitalia abscess, and we have the rubric side effects from drugs because she developed after furadantoin that eruption. Okay, sorry. So we see sulfur, mercury, belladonna, arsenicum, pulsatilla, rustoxicodendron, good remedies. I started with sulfur, but I have to tell you, sulfur is known as a very good skin remedy. And people or colleagues who are not very much into homeopathy, if they see a skin eruption, they give sulfur. I can tell you, in my practice, in my clinic, I'm very, very careful to give sulfur. It really has to be an indication. And here I gave it because it was a side effect of furantoin, of that chemical remedy, medicine. So I said, perhaps it will clear the case. Okay. Twice a day, 10 drops because a severe case. 1 day later, she had less burning. 2 days later, less production of pustules. So we continued 10 drops daily, twice. So after some days, she was better. But I have to tell you, unfortunately, we continued the sulfur and also rustoxicodendron the next weeks. Unfortunately, she was not getting better than this after weeks. Stagnation. So I was thinking, okay, the whole story started after that special antibiotic. So I don't do that every day, but in this case, I was giving the homeopathic potentized drug, nitrofurantoin D30, just 1 dose. And 30% better. Face is good. If you pimples at the chin, redness tip of the nose, always a little worse before menses. So we see she's a bit better. Follow up. Getting worse again. That's our daily life with homeopathy. Better and then worse again, especially with the skin. So I decide, what shall we do? I decide now I'll give the constitutional remedy. Sulfur was more or less has been the first layer. Then, okay, that special isopathic drug, but now what shall we do? Constitutional remedy. So I went back to the case. Redness tip of nose, itching, worse before menses, and abscess genitalia. If you put together these symptoms, we see sepia. And as you told in the beginning, she is a person very sportive, likes to move, likes to swim, likes to ski. And she also told me, I'm a bit impatient. If I have to, she's working in the clinic of my colleague and with the children and the parents there. And if they are too slow, it goes on my nerves. People with me have to be quick. So for us here in Germany, it's a clear sepia symptom also. So she got sepia, C200, 1 dose. And now, the first week, nothing, just nothing. Second week, getting worse. But that can be normal with the 200. Third week, changing the situation. Fourth week, for the first time, no aggravation before menses. So we had to wait with the 200, C200, we have to wait 4 until 6 weeks. And I did do that. 6 weeks, now she's getting really better. 2 months later, everything was gone. So also very interesting to see the different layer in the long-term treatment of a patient. You have the acute conditions, you can have, it can be possible you need a nose out, and then later you will try to have the constitutional remedy, and all these patients, step by step, can lead to success. Okay, now I think my 40 minutes are over.
Yes, doctor. Now we can shift to the discussion time. Those who wish to ask questions or make comments, please raise your hands and make your interest shown to us. And Dr. Sridhara Kurup, our regular hand raiser, Dr. Sridharakur, please make your point very short. Sir, please make your point very short. Yes.
See, in my 18 years, I worked in a research unit with that the bronchial asthma. There, that there is alternating with this skin diseases. That sorinum as an intercurrent and Delcamara is also coming. What about your experience with that? Whether you got any experience such remedies, especially these anti-miasmatic remedies, and also the other remedies like that of sulfur and that these nosols. Are you having any experience? That is my question.
If you mean the normal nosols like Sorinum, Medorinum, Tuberculinum, Carcinosinum, I use a lot. But not in that case. But I have other cases I'm using a lot.
Thank you.
Okay, next is Dr. Manoj. Dr. Manoj.
Thank you, Dr. Beatris. Madam, so nice presentation, and I think the change of potency you have done is good because you at first gave the higher potency and came back to the low potency. It's a right decision. Then what about the diet and regimen? Did you observe any diet and regimen advice? That's just the point I want to know. Thank you.
You understood?
What is the question?
What about the diet restrictions of regimen advices given by you to patient?
No, I don't understand. Sorry, what's the
Do you have any particular food or and a drink suggestion to the patient during the treatment process?
Of course. Sorry, Dr. Manoj. The food and drink, but that's the whole story. So I did not put in this time. First, biological food, of course. Secondly, if we know that there's a reaction, don't take that food with the children. That may be the strongest allergies. Real allergies are cow milk, sugar, wheat, and special form of fruit. But the idea is that the child, by the time, is getting better and can eat everything. So normally in the beginning, I don't give too much restrictions. Okay?
Yeah.
Thank you. Now, Dr. Hubert.
Hello, madam. It was a very good, interesting class. Can you hear me?
Yes, I can.
Can you hear me?
Yes.
You are given her that child some drops of LM potencies in dosage. What the dosage? How much quantity you are saying that some quantity? That quantity is not clear.
Okay. So in my office, I have the globules, LM globules. I take a bottle of 30 milliliter, put inside. They have to shake 10 times, and 5 drops on a plastic spoon or in a bit of water. I'm doing like this. So twice a day, 5 drops means twice a day you take the bottle, shaking, taking 5 drops and give it to the child. Okay?
Okay, then you used vinegar washer. Vinegar.
Yeah. Okay, so that's a dermatological principle. If the skin is wet, don't put cream above. If the skin is wet and moisturizing, you have to put wet, let's say, applications. And here with a child, there was a kind of pus. You had pustules, and you have the inflammation in the legs. And if you put water and a bit of vinegar, it will take it out. If the child is tolerating, if you have open skin, it could hurt. Then they will not tolerate. Okay.
Okay. Thank you very much, madam.
Mm-hmm.
Thank you. Next is Dr. Lokmani Gupta.
Thank you, sir.
Lokmani, yes.
Thank you, sir. Very nice session for homeopathic and skin troubles.
I think he's muted.
You are not audible, doctor. You are muted. Please unmute again.
Sir, I'm unmute.
We can hear you, please. Okay.
Thank you, sir.
Speak. Okay.
Sir, my wife is having some skin trouble since long. In spite of proper homeopathic treatment in my knowledge, and she gets here. Sir, I'm showing picture. Please give the guidance. You must be seeing some hardness on the ankle and some black spots on leg and such black butterfly area.
Mhm.
We are living in very good health. She's very dedicated lady and pious lady. But her mother, her own sister, her father was having the skin disease. If any symptom to us, she is there with me. Please guide what can we do for her.
Dr. Shadi, could you explain a bit to me?
There is a lesion, as you have seen, in the ankle joint. Then in the cheek, in the face area, some blackish discoloration.
Yes, yes.
Dr. Lokmani, can you explain once again what you mentioned?
All the three things you had explained very well. We are giving homeopathic medicine, but not getting very good response. Her mother, her father, and all the sisters, even brothers, are having the same trouble in the family.
So it is genetic.
So, having the same problem.
Okay.
Yeah.
Okay. It seems to be a bit, because it's more black or dark blue, it seems to be something of the veins. Dr. Gupta, it will be a difficult situation to treat, but should be possible to help. But for me, what I see from the distance, from Germany now at the screen, it seems to be blue a bit. So perhaps you could try with a venous, with a remedy which is acting on the veins, like Hamamelis. I have good results, or could be many different remedies. Okay, and if it's genetic, perhaps start there. Yes, yes, interesting. So if you like, you also could contact me. I try my best, but yeah.
It will be my pleasure to have a contact and guidance.
Yeah, okay. I could have a look.
From where I can get your number, please?
Yes, Dr. Shadi can give my number.
I can give you.
Yes.
Thank you, sir.
Okay.
Okay. That's a pleasure.
Okay, next is Dr. Amir Malik.
Hello, sir. Good afternoon. Namaste. Salam to all IFPH members, creators, lovers, and special thanks and honor to Honorable Dr. Beatris from Germany. Hello, Honorable Doctor. How are you? God bless you. You have given a very great and very good examples of skin diseases. It's really appreciated, and God bless you. I am really waiting to show the role of homeopathic medicines in skin diseases on international level. And we really are proud of that. And we're really proud of that, by the invention of this science, this is a blessing on humanity, that the cases of leprosy and skin cancers of third degree skin cancer, which is untreatable in here, our country, the Shaukat Khanum is very famous for the skin cancer treatment, and Anmol, they surrender. Where they surrender, the homeopathic start works from there. And I have a case of skin cancer, which I would like to just give the details of the medicines, the incredible medicines we have. One of our Honorable Dr. Gupta asked about a skin ailment, which is not identifying properly, because we have to check the pictures and practically the condition of the skin. But I will let you know, sir, one of our king in skin diseases is hydrocotyle, which treats leprosy very incredibly. Any kind of stage, entum crude in 3x, hydrocotyle in 3x, and I will let you know the very, very, very amazing effects of a medicine, radium bromide and irradium. These are two radioactive isotope, the two metals, which is also used in radioactive isotopes, radium bromide and irradium. They have incredible results in skin cancer and the third burn skin stages. Unbelievable. But the cases, Honorable Dr. Beatris, you showed, it's very, very, very great. Very great examples of skin diseases, which is handling, and amazingly, you handle that
Thank you,
disease.
Dr. Malik. I can tell you, I have much more cases. I also, time goes by. I also for today had 3 more cases with the faces and different things. So if you are interested, we could have another session to go on. Because I also feel with the skin diseases, you see the picture, and also people who don't believe in homeopathy, they see the picture so clearly. And if they are getting better, it's very impressive. So, okay. Yes.
It's really appreciated, Honorable Doctor. We really appreciate.
Dr. Malik, thank you. We have one more person waiting, one doctor waiting to be given time. So Dr. Danesh, please make it 1 minute. Our time is getting short. Dr. Danesh, please. Yeah.
Good evening, all. It's a very good presentation, madam. It's a very good presentation indeed. And we really love to hear that in Germany also your homeopathic doctors are doing wonders with the skin problem. And we are. I just want to ask a question: how many patients you used to get in a day in Germany, particularly the skin disease? Whether you are practicing only skin disease only, or whether you are going with almost all kind of diseases that comes underway.
Yes. I am personally have a bit of impact in skin diseases. About 40% of my patients have skin diseases, and the others have all different kind of general medicine. I'm doctor for general medicine. Okay.
Okay.
But it's like this. Many doctors from my region send patients to me because it's not so easy to treat skin diseases. For me, it's easier to treat an asthma or bowel problems, intestine problems, but the skin is a bit tricky.
How much time required for you to complete a case taking for a skin disease? This is
okay. Like also for the other patients, we in Germany we have it in a different way. If a child is coming, I need more or less 1 hour. For the adult,
okay.
1 hour and a half. If they're coming back, 15 minutes, 13 minutes, something like this.
Okay, thank you. Okay. Thank you very much for your excellent presentation and answer.
Dr. Danesh, please say a vote of thanks on behalf of IFPH.
I'm very delighted to have a session with our International Forum for Promoting Homeopathy, or the 309th day here. It's a way really going higher and higher level, and we are having excellent presentations from almost all doctors from all over the world. And this is something that we are looking for. And this is a platform where we are connecting together, and we are having contact with almost all this. Particularly, we get good friends from Pakistan, from Turkey, from Germany, now Australia, and from almost all part of the world. We are getting good eminent doctors coming in this platform and presenting beautiful cases. And this is something really really never happened before in the history of homeopathy. And this is something, a new way we are growing, and homeopathy is growing. And that's why we say that homeopathy is going to be the #1 system in the world within a few years from now. And because almost all doctors are getting good number of patients, whether in India or in Pakistan or in Australia or in Germany. Also, we will connect together. And I'm very happy to say that a lot of doctors are participating, as well as homeopathy lovers also participating in this session. This is something, an extraordinary thing that is happening, connecting between people and connecting between doctors, and all are coming together and discussing homeopathy for the betterment, how to improve our system, how to give more to the people, and all these things are discussed here. And this is what I would
Thank
like
you.
to say. And I'm very happy to say thank you to Dr. Bennett, good sir, and all the other doctors for participating in the discussion, as well as watching this entire program. And thank you once again for all for your participation. And okay, ma'am, good night.
Thank you, Dr. Beatris. Thank you, all the participants. Now I apologize to Dr. Muhammad Syed, and we have a lapse of time, so I hand over the platform to the Malayalam session, everyday happening since our 5th July onwards. So over to you, the next session. Thank you. Good night.